Welcome to MD Conversation. This module discusses the use of prednisone as a treatment for inflammatory bowel disease. This information is taken from a recent review of the medical literature and attempts to be as comprehensive as possible. However, it may not necessarily reflect the experience of your healthcare provider or the specifics of your situation. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or skip through them in any order you wish. Prednisone is a type of steroid called a corticosteroid that can be taken by mouth. Steroids are commonly used to treat inflammatory and autoimmune disorders, including inflammatory bowel disease, and work by numerous mechanisms to control inflammation and the immune system. Another corticosteroid is called budesonide, which has similar effects. These drugs do not have to be in direct contact to have an anti-inflammatory action. Instead, after they are absorbed, they will release a quick anti-inflammatory action throughout your body. Steroids act very quickly, more so than another class of drugs used to treat inflammatory bowel disease, called 5-ASA compounds. For interest's sake, let us review the history of this amazing drug. On April 29, 1948, Edward C. Kendall finally produced a few grams of a substance called compound E. A physician named Philip S. Hench joined with Kendall at this point, and together they discovered that compound E could be successfully used to treat patients with rheumatoid arthritis. They christened this substance cortisone on July 1, 1949. In 1950, Kendall and Hench were awarded the Nobel Prize. In 1950, Arthur Nobile at Schering Pharmaceuticals demonstrated that the side effects of cortisone, such as water retention, high blood pressure, and muscle weakness, could be removed by oxidization of the drug through exposure to microbes, and invented prednisone and prednisolone. These drugs have saved many lives, alleviated much suffering, and become essential for treating autoimmune diseases like rheumatoid arthritis and lupus, a skin TB, and as a component of multi-drug cancer treatments. Prednisone was approved by the FDA in 1955 and introduced to the market by Schering in the mid-60s. As noted, prednisone is in a class of medications called corticosteroids, which is a type of steroid. Steroids help control our metabolism, inflammation, immune function, salt and water balance, development of sexual characteristics, and our ability to withstand the stress of illness and injury. Steroids are a group of hormones with similar chemical structures. They are normally produced by our adrenal glands, located on top of our kidneys, as well as our reproductive organs, the ovaries and testicles. One of the steroids produced by the outer portion of the adrenal glands is called cortisone. Cortisone helps regulate the body's salt and water balance and reduces inflammation. Prednisone is a man-made replica of cortisone. Our adrenal glands normally produce an amount of steroids equivalent to about 5 milligrams of prednisone a day. When prescribed in doses that exceed natural levels, prednisone suppresses inflammation and can help treat a variety of diseases such as ulcerative colitis and Crohn's disease. Prednisone acts in part as an immunosuppressant. In other words, it suppresses the immune system. The immune system normally functions to protect you against infection, injury, cancer, etc. Unfortunately, while it is vitally important in these respects, the immune system can sometimes function abnormally and produce antibodies which cause undesirable effects. Prednisone will suppress the production of such antibodies. This can make it slightly harder for you to fight off infection, but also stabilizes the immune system if it is overactive. Prednisone comes as a tablet or a liquid to be taken orally, meaning by mouth. Prednisone is usually taken with food 1 to 4 times a day or once every other day. Your doctor will advise you of when to take your dose. The amount you take and the times at which you should take it will depend on your condition and how you respond to the treatment. Please follow the directions on your prescription label carefully and ask your doctor or pharmacist to explain any part you do not understand. Take prednisone exactly as directed. Do not take more or less of it, and do not take it more often or for a longer period of time than prescribed by your doctor. Furthermore, it is critical that you do not stop taking any steroids abruptly without contacting your physician. You must gradually come off these medications under the direction of a doctor to avoid possible serious side effects. Side effects of prednisone and other corticosteroids range from mild annoyances to serious, irreversible damage, and they occur more frequently with higher doses and more prolonged treatment. Side effects of taking prednisone for a short term are cosmetic side effects such as weight gain, fat redistribution, acne, facial hair, swelling from water and salt retention, and neuropsychiatric side effects such as mood disturbance, depression, insomnia, high blood pressure, and glucose intolerance, high blood sugars. Side effects that can occur from taking prednisone for more than 3 months include thinning of the bones, cataracts, steroid dependency, and steroid-induced diabetes. Some side effects can be serious. If you experience any of the following symptoms, call your doctor immediately. Vision problems, eye pain, redness or tearing, sore throat, fever, chills, cough, or other signs of infection, seizures, depression, loss of contact with reality, confusion, muscle twitching or tightening, shaking of the hands that you cannot control, numbness, burning, or tingling in the face, arms, legs, feet, or hands, upset stomach, vomiting, lightheadedness, irregular heartbeat, shortness of breath, especially during the night, dry, hacking cough, swelling or pain in the stomach, swelling of the eyes, face, lips, tongue, throat, arms, hands, feet, ankles, or lower legs, difficulty breathing or swallowing, rash, hives, or itching. In summary, prednisone is a man-made corticosteroid used to manage the immune system and inflammation. When prescribed in doses that exceed natural levels of hormone, prednisone suppresses inflammation and can help treat a variety of diseases such as ulcerative colitis and Crohn's disease. Prednisone acts in part as an immunosuppressant by suppressing the production of antibodies. Please follow the directions on your prescription label carefully and ask your doctor or pharmacist to explain any part you do not understand. Take prednisone exactly as directed. Possible side effects of taking prednisone are weight gain, water and salt retention, puffiness in the face, headache, and muscle weakness. This slide lists some of the many resources available where you can find more information about prednisone. We sincerely hope that this module has furthered your understanding of prednisone treatment for inflammatory bowel disease. We wish you the best for the future, and thank you once again for using MD Conversation.